Good afternoon, everybody. Thank you very much for joining me today on our 2021 Final Rule webinar. All right, everybody should be able to see my screen right now. We have a lot in attendance today, so thank you for participating once again. I'm happy it is 2021 and we are finally here. This is going to be going over capitalizing on higher incentives amidst a tougher MIPS program, and each of the steps will we'll go through each of the steps that you need to take to do well this year. So let's get this party started. My name is Mike Lewis. I am a MIPS specialist here at HealthMonix. I've been here for 2 years with about 6 years of MIPS consulting experience prior to starting here. So today we have the handout section down on the bottom right-hand side of your screen. You'll see the handout section as well as questions. If you have questions, please ask away. I cannot promise you that I will get to them today as I'm running solo today, and there is a lot of information to share. However, I promise that I will get you answers to each question, most likely by tomorrow, but for sure by the end of this week if you have questions on the information. So please feel free to ask as many questions as you would like. So the things that we're going to review today in the 2021 final rule highlights, how those final rule highlights will impact you, and what are your steps now? What are you going to do now today? What can you do to make a difference in reporting today? So CMS had a couple objectives for 2021 reporting. Even if you don't believe it, minimizing changes to reduce the burden on providers digging out of COVID-19. So what is it that is going to minimize the differences between 2020 while also giving you the opportunity to participate in the program fully this year? They want to keep the momentum of the quality payment program moving forward. So instead of being a program where it's stagnant for a year, like many of the commenters on the final rule said, they want to make sure that the program's moving forward and that we keep increasing the intensity of what this program's about and how it's to help the patients at the end. As well as third, make it easier for providers to progress into alternative payment models. That's the end goal, is to get as many people into those alternative payment models where payment is going to be made based upon the care given to the provider instead of the patient, instead of the fee for service. So there were some overarching themes. You'll realize if you were part of the proposed rule webinar earlier in, I think it was October or November range, I have a number of these slides contain a lot of the same information. However, they did finalize it, so I wanted to share that with everybody. The overarching themes: reducing administrative burden, simplifying reporting options, incorporating telehealth into every aspect of the visit, and ridding or changing measures that do not garner the desired outcome. So what didn't change? A lot of things changed a little bit. There were some pretty big changes we'll get to, but these are the things that did not change. So the first is eligibility. It's the same 90,000, and in Medicare B charges, 200 patient visits, services, as well as 200 patients are needed to be eligible for MIPS reporting. And there are options to opt in if you meet one of the 3 of those eligibility standards. Otherwise, if you meet none, you're not eligible for MIPS reporting as an individual. Unless your group meets those numbers, then you can report as a group and be part of that group. The eligible provider type stayed the same. The exceptional performance threshold staying the same at 85%. And the quality data completeness is also staying the same at 70%. So here are your new categories for 2021. You'll see here there was a very slight change, but what was proposed and moved forward is the ability to have costs to take up more of your score. So you can see here, all it really did was take 5% away from quality and move it over into cost. So now cost is 20% and quality is 40% for 2021 reporting. So the biggest impact from everything I read, there was about 2,000 pages this year in the final rule, but the biggest impact and the most questions were about the minimum threshold to avoid the penalty. And that has increased this year from 45% to 60%. You can see as the program started in 2019, you just needed 3 points to avoid a penalty. Then it moved up to 15, 30, last year it was 45, and moving forward in 2023 is going to be 60 point. 2023 payment year, this coming year, is 60 points. There is no easy way out this year. 45, there were, you could partially participate and still beat the penalty threshold. That's not the case in 2021. You will need to be reporting fully on most likely each of your categories to report and avoid the penalty. And estimated by 2024, they're estimating that it's going to move north of 74 points to avoid the penalty. And the reason they are doing that is because by 2024, the program needs to be neutral, and the losers have to be able to be the same amount as the winners in the program. So therefore, the thresholds are moving up. So how does that impact you? As I said, this is the year MIPS finally counts. There are no easy way out. In the previous years, or you could do 6 measures, 1 patient each for small practices. You cannot participate in PI. You don't have a cost score. There are a number of areas that you have that there is an ability where you don't have any way out in 2021. Then incentives will also be at the highest level since MIPS was introduced. So the opportunity to make money on this program is finally here. It might remind you of the old days of meaningful use where there was money available to providers for reporting. Well, the more Medicare patients you see and the better you do in MIPS, there's an opportunity this year to make a very decent amount of money. More providers will also be penalized this year. More are going to fall short. There are going to be a lot of people that put their hands up and say, I'm done. I'm not doing it this year. So what that's going to do is it's going to increase that pot and give the ability for people to make more money. So don't be on that end. Be on the end that's going for the bonus, and you should be able to make those improvements to get there. And as I stated earlier, it's budget neutral in 2022, so they're going to raise that penalty avoidance to a threshold to make sure that it is break even. So the revenue impact that I was just mentioning. Once again, this year, the maximum penalty will be 9%. That number will be on there for anybody that does not participate in the program. That does not report on at least 2 of the reporting options. So it can't just be your cost score that gets you across the finish line. You need to participate in improvement activities or quality or so forth. The break-even point, as you can see here, is at 60. And then the maximum that we're seeing, according to the final rule, is 7.36% for those who are scoring in the exceptional performance range. The better you do, the less penalty and more incentive you can get. So you can see it's not a straight 9% if you do not get to 60. It is, it's not lateral. So another thing, part of the final rule that you might not think is MIPS dependent, but the physician fee schedule also had a major impact this year. As you can see, specialties listed here, and there are many more. I just picked out a few of the specialties, a lot of the ones that are our customers already, where they landed on here with -9%. and lower some of these specialties, and then there's other specialties that have an increase. But these are the ones that are being hit the hardest from what I saw. So performing well in MIPS can offset the negative impact from the reduction in the physician fee schedule. So take a look at this. If you're on here, I think you probably already know that you're on this and that you need to report MIPS and do well on MIPS to offset some of these challenges that they are putting in front of you with the physician fee schedule. So what can you do today? There are a couple steps to take to maximize your return on investment. This year is all about the return on investment. What are you paying and what are you putting into reporting MIPS and doing the quality information and figuring out how the staff works with it, how your EHR works with it. Are you using paper? What are the patient outcomes that are helping you, and so forth. So the first step is maximize what you get out of your quality measures, choosing the right measures. And we're going to go in depth onto that one in just a little bit. Have an internal meeting with your staff to discuss the importance of MIPS in 2021. So the main thing here, and I've done this in years when I was consulting, is get everybody in the practice or in the hospital system or in your group to really understand the importance of MIPS this coming year. It's not enough just to have your MAs or your nurse or just the doctors and office manager. Make sure the biller knows how important it is. Make sure the front desk knows how important it is. Make sure every step of the way people understand what 2021 MIPS looks like. And feel free to use this deck and the slides to show them and to go over and print them out and, show everybody during a lunch next week or so forth. It's important that everybody knows, because that way everybody will, even if they see something that might be wrong, will be able to help and fix and realize that there's something going on. And yes, you will be receiving the slide deck afterwards in an email, as well as you can get it in the handout section attached on the right-hand side of the screen. I've seen a couple questions on that. And then the last thing I have here is get the right tools in place. Know what your EHR, your submission platform, billing companies, consultants, your telehealth programs, and so forth. As you're working through this year, make sure that you are prepared for reporting and that there's no surprises in November and December. And there's no surprises when you go to report next year in 2022. Make sure everything is lined up very well and you are prepared for this year. So the first thing that I wanted to go over when choosing measures, because I do believe that choosing measures this year will be just as important as it has been in the past, with a little extra bit, because they're getting harder. The measures are getting harder, they will be getting harder, and so forth. So if you can see here, CMS creates benchmarks based on historical data. The 2021 benchmarks were created based on 2019 data. Each reporting type has its own benchmark. So if you take a look at the information on the right-hand side of the screen, you will see these are two very popular measures, and what your scoring would be by reporting through each one of the options. So the Medicare Part B claims is going to be furthest to your left, and then it goes to MIPS CQMs, which are registry measures, and then the last line you see there is the eCQMs, which are your electronic clinical quality measures. Those measures and the MIPS CQMs can be reported through a registry just like MIPS Pro, and they give you a better opportunity to score well. So you can see, for instance, on that first measure up at the top, where you top out at 7 for the MIPS CQM, you also top out at 6 points for the claims, but you top out at 9 points for the eCQM. So as long as you have end-to-end reporting, you will be able to report the eCQMs through MIPS Pro. There will not be CMS benchmarks provided prior to the close of the reporting period to the following measures due to changes in the measures. So these are all pretty popular measures, especially 226, which is the smoking measure, 431, which is the alcohol measure. These measures are sitting here without benchmarks. However, they will be benchmarked next year based on the changes that they have implemented within the measure. So 5 details when to consider when choosing measures, and I'll spend a little time on this, but choose measures that fit into your specialty. This is becoming more important for multiple reasons. Number one, it makes it easier on your staff if they understand the measure and you're not a dermatologist asking about colonoscopy screenings or a gastroenterologist asking about melanoma. Um, so you want to choose measures that are there that make sense to your practice. The other part of this is that in 2022, the MVP program will be starting, and we'll take a look at that later on in the screens. But with that, it really is narrowing down to your specialty and giving you the opportunity to report on all the categories, the quality, the improvement activities, and the cost categories all around your specialty. So getting started with that in 2021 is a smart idea for a lot of reasons, but I think the most important is that moving forward, that's how the program wants to calculate your scores is based on your specialty. Choose measures that have small denominators. That's just always something that I have put in there. Choose 1 or 2 measures that have really small denominators, as long as it's over 20 patients if you're an individual reporter, or 20 patients if you're a group between all of the providers, that you will be able to score very well on that measure, and you have more opportunity to really take a look at that measure and make it work. So find a specialized measure that might limit your patients to, diabetic patients over the age of 65, or a measure that has, I have a lot of experience in dermatology, but your melanoma patients where you're already doing the work, but the denominator is much smaller than your entire patient base, things like that. Look for measures that are not topped out. I'll have topped out measures on our webpage, hopefully by the end of next week. They were just reported out, so I didn't have an opportunity to get them into this slide deck, but pick measures that are not topped out. You don't want to pick a measure, do all this hard work, and it only gets you 5 points or 7 points or 3 points in some circumstances. Make sure you're able to get as many points as possible from these measures. However, there will be measures that you just have to do at topped out, and there's a way to make up bonus points that I'll show you in the next 2 points here. So finding extra high priority and outcome measures. You can get bonus points if you report more than 6 measures. So if your first 6 measures include an outcome measure, you'll get those 6 measures. But then if you report extra outcome and or high priority measures, you will be able to get bonus points for a few of them. There is a cap at 10% of your score, but you will be able to get have the opportunity to get extra credit for the high priority and outcome measures. The only caveats are you need to report on at least 70% of your patients like you normally would for a regular measure, and you have to have at least 1 patient in the numerator for that to count. So you can't just report an outcome measure at 0/5. You need to make sure there's more than 20 patients and you have 70% of the data completeness, and there's at least 1 patient in the numerator. Next is look for measures that you can report as ECQMs. There are a number of ECQMs on our registry, about 50 or so, and you'll be able to look at those and you get an extra bonus point. The end-to-end reporting is very nice. Plus you get the better deciles utilizing the ECQMs. So let's keep going. I see some great questions coming in, and we're going to get to some of the measures in a minute, so they'll be there. So finalized changes for 2021. These are your measures. The chart is a little interesting because you can have a measure maybe specified under multiple collection types, but will only be counted once in the total. So as you can see, if you take a look at the MIPS CQM specifications, that's what it's like reporting through a registry. You can see that there were substantive changes to 101 of them, as well as measures finalized for removal. There was 11 removed, and we'll go over that in a minute. You can see the measures remaining, 185 for CQMs, but you could also add those 47 ECQMs to what you can report through a registry. So quality measures being removed. You could see a list here. I'm not going to go through all of them. I see a couple questions about Measure 48. Measure 48 was not removed. They were thinking about it, but did not do it. It was not finalized this year. But you'll see here measures 12, 69, 146, and so on. These measures were removed from reporting in 2021 and for various reasons why they were chosen. So this list is very long. You can see here, these are the measures with changes in 2021. It's about half the measures that are out there. So pay close attention. A lot of the changes weren't large changes. They were quite minimalistic when you're taking a look at them measure by measure, but there were some impactful changes. So for instance, you'll see some of these ones have substantive changes. You'll see a lot like 110 added telehealth as an eligible encounter. So as I stated earlier, that telehealth was an important factor in MIPS reporting for 2021. So you can see here added telehealth as an eligible measure. That's for a number of them. There were a number that also included adding clinical social workers. Measure 47 is like that. Their Measure 130, there were some minor updates. It's another popular one. The big changes I see that really changed the measures were shortened look back period for Measure 226, a very popular measure for smoking. So now it is a 12-month and counseling every 12 months instead of the 24 months that it was in the previous 2 years. Measure 431, the alcohol screening one, was an easy, simple one question measure in the past. Now they are splitting it up to look very similar to Measure 226 for smoking, and it has 3 submission criteria as part of it. So there are a couple quality measures being added. However, they are quality measures that are claims reported only. There's a hospital-wide 30-day all-cause unplanned readmission, and there is also a risk standardized complication rate following elective primary total hip arthroplasty. So both of these measures are claim-based. They both are for larger hospital systems, and they both are outcome measures, and they're only reported on patients that are 65 and older. The other thing that's important about these measures is they've also been added to a number of the other programs that CMS runs, including ACO reporting and so forth, for people to track. So these 2 measures were brought in across the board in almost every program. So improvement activities, there was not much changes. They modified 2 activities. The first one, they added caregivers as potential users and changed the language that the primary use should be clinical and not administrative. The second one, for comprehensive eye exams, added language to promote access to vision rehabilitation services for patients that have chronic vision impairment. And they did remove one measure, the Partner and Patient Hospital Engagement Network. The program expired, so they removed that measure, and then they did finalize the adoption of the COVID-19 clinical trial measure. So while that was, you had the ability to report that in 2020, it became part of the final rule for 2021 with this latest release. Promoting interoperability, there were a number of changes. So we have here the query of prescription drug monitoring program. The bonus is going to increase from 5 to 10 points, and it still will remain an optional measure. If you have me guessing, I would believe that in 2022, this will not be optional anymore. There was a lot of thought of making it mandatory this year, but due to COVID and PHE, they had the ability to make this optional again once again for 2021. There is an introduction of a new optional measure, health information exchange, bidirectional exchange measure. This bidirectional exchange means that the clinician's EHR is enabled to allow for querying and sharing by data, sending, receiving, and incorporating data via HIE for every patient. That is interoperability. At what we can offer at this stage is the ability to talk to these HIEs that are out there. And the last thing that changed for PI is the measure name change. Nothing else there. You can see it added the word reconciling instead of incorporating. Just playing wordsmith in their measures, I believe, from everything I read. So these are the finalized changes for MIPS 2021. You still have your e-prescribing, you still have your information exchanges, your provider to patient exchanges, and then you also need to be part of the public health and clinical data exchanges. Also, very important, is that a security risk assessment, while it isn't points gained, everybody that participates in these programs and even everybody that sees Medicare patients should have a security risk analysis. And if they do not, they will get no score for PI in here. So it's a yes or no question when you attest. However, if you answer no, you will get a 0 for PI, just like in the past. So the last component's the cost category. So the MIPS component points here that you can see, it is increased again from 2020 to 2021. You can see now that it is at 20% of your score. And by law, in 2022, it will be equal. So quality and cost will be equal for those that have quality measures that are associated with their practice. Is moved up once again, as you can see, every year except for the skip from 2019 to 2020, making this category extremely important. So a little tip and trick here, we'll step in, get started at the beginning of the year. So a couple little hints from me that I think that are timely at this point. Start tracking each MIPS category in January. I recommend getting your 90 days for PI and IA over with so you can spend more time on quality and cost, as they will be a large portion of your score this year. Utilize a program like MIPS Pro, here's my pitch, that can provide quality measure benchmarks early in the year. This gives you the opportunity to take a look at every measure and find out what's going to work for you. We're going to have that information in our system even before a lot of the information is available through CMS. Focus on performance improvement by attacking those gaps in cares. Take a look at each provider and see if someone's not carrying their weight. One provider scoring poorly can bring a group score down dramatically. Patients, see if there's a patient type that is causing your scores to suffer. Lately, I've heard from people that there's certain ethnic groups, or there are certain zip codes that are part of their patient base that have caused them trouble, and they're doing special reach out programs to them, whether it's a different language they speak or a religious observation, the religious reason. There are reasons why they aren't getting the answers they need on these groups. Dive into that information and take a look at what's causing your scores to come down. Also, comorbidities. Maybe it's your patients with diabetes that aren't qualifying for certain measures, or that you're not doing the work that's needed for those measures. And then take a look at measures that may have been overlooked. Within a system like MIPS Pro, you're able to track as many measures as you want. And this goes back to my finding that small measure. Find that measure you may only have 20 providers for, 20 patients for. And if you have those 20 patients and you're 20 over 20, 20 over 20 is just as good as 1,000 over 1,000 or 500 over 1,000. It's much better. So find those patients that are more, find those measures that are more specialized, that have low patient bases. It can really help boost your score, because there are those measures that you're just not going to be able to get away from a practice standpoint, that are topped out or that are really hard to reach the top numbers. Track more than 6 quality measures. Start tracking more, as I just stated here. Start eliminating measures through the year to optimize your time. You know, you don't need to track all 100, 200 measures in January all the way through December, but maybe you put 100 measures in your tracking system to start, and then after a couple of weeks you realize that you have zeros across the board on a number. Get rid of them. Lower that down and make sure you have the ability to do well and improve on those measures. So, penalty avoidance. As I said, this is the year there is no easy out. Now, in past years, I shared with you ways that you could avoid the penalty without doing too much work, without really digging into the program needs. That's not the case in 2021. There is no easy out for this year. So you could see from here that every category basically needs a 50% completion or 50% score for each category will get you 60 no matter where your exemption stands. So you could see the first ones with no exemptions, they need at least a 50% score in every category. I know you don't have much impact or you feel you don't have much impact on cost and complex patient bonus. We have some ways to help you with that, but I gave a medium score for each one of them of 50%. And you can play with the numbers, improvement activities, everybody do them. It's 15 points. Just don't not report that. It's free 15 points. I've never seen people that have been exempt from that. So if that's going to help you offset some of the pain from some of the other categories. So you can see each year you'll get, to get 50% in quality, an average measure score of 5 points is needed. So you need to make sure that you're at 5 points just to avoid the penalty. That has never been the case before, but this year it will be of the utmost importance. And if you need to go through step by step for your individual practice or group and you want to discuss that, I am available to kind of guide you in the direction that you want to make. Whoop. So a couple other changes that were finalized this year. We have the scoring hierarchy. TINs and MPIs sometimes could have more than one final score. So here is a comparison for 2020 compared to 2021. So you see over here, it was much more complex last year, but in 2021, the only thing that supersedes your highest score would be your virtual group final score. Otherwise, all of those other scores that are available to you, whether it's your APM final score or your highest APM final score or your highest of your group and individual scores, will be reported. So one important thing that's nice is through a system like MIPS Pro and through other programs, you're able to report as a individual and as a group at the same time. So if you report as an individual and you get a 75 and you report as a group and you get a 55 as a group, you will get that 75 score as an individual without hurting the group score if you're taking out. So the other big thing is the introduction, the APM performance pathway. So CMS has created another option for MIPS APM participants to submit through collection types other than the CMS web interface. A qualified registry like MIPS Pro is now an option for reporting your quality measures for 2021 APM performance. So CMS has delayed the sunsetting of CMS web interface that was expected to be removed for 2021. However, they moved it forward to 2022. So this will be the last year of the CMS web interface and an ability to report directly to CMS that way. The new collection types are anticipated to reduce the reporting burden for its providers. It standardizes the quality measures and the population health. You have your MIPS survey is the first one, then measures that are your normal quality measures, your diabetes, your screening for depression, and your controlling high blood pressure. And then, as I said, stated earlier, those are the two claims measures that are at the bottom. Cost store will continue to be reweighted to 0, and you will automatically get 100 for your improvement activities as long as your APM participates in them. And promoting interoperability will be scored as individuals or groups. While I'm on this page, I did want to share that it is even getting more difficult to understand the difference between whether you are a qualified QP or if you are need to report MIPS and where you stand and if you're a partial and everything. We can help you here with that, but a lot of times CMS isn't even sure on some people until the year is up. So make sure you know where you stand when it comes to these programs and how you need to report moving forward. It's very, very important as more and more hospital systems are joining APMs, they are dragging underneath them those providers that are associated with them. So just keep in mind when you go to report. The complex patient bonus, so this is an extra bonus at the end of your MIPS score, has been increased in 2020, so backdated. So for this past year that you just reported, from 5 to 10%, that is a bonus on top of your MIPS score, and that is due to COVID-19. It is added to your MIPS score at the end, and it's based on the complexity of your patients. The mathematical equation for that is the combination of hierarchical condition categories, so your HCC, risk score, and dually eligible patients. So those patients that are Medicare and Medicaid compared to those who are only Medicare patients. So what's next? We discussed the MIPS value pathways. So you can see here, the original start date was going to be 2021. It has been pushed back to 2022. That should say the final rule, not proposed rule. I missed that on the slide. It's moved towards an aligned set of measures, and it's probably going to take 3 to 5 years to fully implement. This is the way they want the program to go. They want each of the specialties to have their own cost, quality, and improvement activities on top. With those, underneath that, the foundation is the promoting interoperability, the population health measures, and enhanced performance feedback, patient-reported outcomes. All of that is built up to everybody will do the foundation, and then for each individual specialty, you'll see up at the top how it equates to your practice. So what's next? Continued with the MVPs, especially providers will have measures that reflect their scope of work. Quality, cost, and IA will be aligned under each specialty. More providers will be eligible for the cost category, so pay attention to that. For those who have not been had measures that they were associated for cost and have been exempt for a number of years, that won't be the case this year. Reduce the burden and drive impactful care. The reporting on measures that make sense to you, drive process that improve health outcomes, and improve reporting and the CMS data. So that is all the plan with the MVPs. Just for you to know, on top of that, we will have Lauren Patrick and Saritha Curry from Healthmonics and Joy Rios from Chirpy Bird that will be presenting during a fireside chat in 2 weeks from today. They are going to go over the insights on the future of the quality payment program. So based on the final rule. So taking a look at this rule and where is it going and where are we headed when it comes to MIPS reporting. So determining your strategy, reporting methods, why a registry? Registries maximize your return on investment, gives you more measures. So a registry like MIPS Pro has over 200 measures, giving you better options for your specialty, allows you to pick the measures in which you score best. You could deal with experts. So here, when you're talking to someone here, you are talking to MIPS experts, people that do MIPS all day long. That's what we do, and that's what we're great at. We combine data from multiple EHRs, practice management systems, billing systems, paper charts into our system to allow you to report on. Track data all year long to allow for performance improvement. I think this is the year where that's most important. Make sure you're getting in there in the beginning of the year, taking a look at your measures, understanding where your faults are and how you can improve on that. You're still eligible to receive the end-to-end bonus and also to report on your ECQMs. And dig into your data and attack your gaps in care. It's very important this year to not let any points go, to be able to take a look at this information, make changes earlier in the year so that you can prepare yourself for reporting in 2022. MIPS Pro offers live dashboards and drill-down capabilities that help identify gaps in care, performance improvement, score optimization, outlier detection. You can see here, this is a picture of a basic dashboard showing you where you stand compared to the deciles that are out there. This is a group score, and you can break down the individual scores and so forth. Here you're taking a look at our easy to navigate dashboard, allows you to drill down into performance improvement, leading to better scores, higher reimbursement, and in the end, what is most important to us and to you is improved patient outcomes. So we're here to help you. We have our best-in-class US-based support team located right outside of Philadelphia. Our integration team is here and we are growing every day. So the ability to bring in your EHR data is becoming easier and easier. And we are here to provide the highest quality of healthcare so that you can help your patients. One last thing I want to go over, introducing Healthmonics' MIPS cost solution. I mentioned earlier, cost is getting more important every year. As you can see, it's jumping up to 30% for 2022, so it's a good idea in 2021 to get a handle on it. We've created the first technology platform that provides current year payment data for all Medicare patients. How this is going to help you, we're going to be able to estimate your MIPS cost score throughout the year. We'll give actionable insights into each cost measure, provide you your anticipated attributed patients and episodes. You're able to see everything from inside and outside your practice for every patient that comes to see you. Help support you with HCC scores and allows you easily identify those patients and providers that have the largest impact on your cost. So your top 10 patients who cost the most in a certain category, you'll be able to break apart within our program. So don't miss out on our webinar series. Look for it coming in February. We'll have more in February. Plus, you see the one on the 19th where we'll be joined by Chirpy Bird, as well as our CEO and our head of customer success, our VP of customer success here at Healthmonics. So let me take a look at some of these questions and get to them. So the first question I see here, does MIPS Pro connect with Dr. Chrono to gather data for reporting? Yes, in 2020 and 2021 will be the preferred vendor of Dr. Chrono. You can reach out to us here at our team at the number on the bottom of the page here and talk to one of our specialists here that can get you hooked up with the Dr. Chrono information for you. And everybody, please ask your questions now. I'll try to get it to as many as possible. Another person asked about the 2019 MIPS reporting. The way 2019 MIPS reporting worked out and the bonuses being awarded, no bonuses were given to anybody that scored in between the penalty and the exceptional performance. The only people that received bonuses on 2019, so starting right now for 2021 payment year, are those that were in exceptional performance range, and that year it was 75 and above. So if you did not score 75, but you scored above the threshold, which was 30 at the time, you would get 0. I hope that helps. Does a solo practitioner that uses claim-based submission still need to do a security check? Yes, everybody that participates in Medicare needs to do an SRA, security risk assessment. Will there be a hardship exclusion again for small practices in 2021? Yes, and I recommend that if you have the ability to take that exclusion, that you go ahead and do it, as the PI portion is the hardest portion for you to get a perfect score on. So someone asked about the claims-based measures. Once again, we don't report through claims-based here at Healthmonics. However, there are a number of claims-based measures. They just happen to be harder to score on, and there's only 2 new claims-based measures out there. Someone asked about measure 48. Once again, 48, I stated earlier, it was not removed this year. I anticipate that it will be changed or removed for 2022 reporting. They wanted to get rid of it this year, but they did not. Everybody will receive a copy of the webinar slides as well as this presentation in an email this afternoon. Physical therapists still only able to report IA and PI. Yes, that's all they will have available to them. Therapists, including psychologists, as well as physical therapists, occupational therapists, audiologists, and those who are not patient facing do not need to report for promoting interoperability still this year. And there are no cost measures that I see that should impact those specialties, but you never can tell based upon what you're doing and how you're sending patients across the board into hospitals and so forth. So CMS, I believe, posted most of the measures just this week. I have to check. I know the topped-out measures were. I don't know if all of the measures are, but I will take a look into that and hopefully be able to come up with an answer for you on what the deciles look like moving forward in 2021 reporting. A couple people asked about the measures. There was some information late last night that I saw, but I'll be able to confirm that later. Additional information on MVPs. One provider's asking here about radiology. There was some information in the final rule about the MVPs, and we could probably take a look at that, but I don't have any specific information right in front of me. So I'll see what I can do to get you that information. Decile performance is not, we don't have that calculated just yet, but we're getting there. Where can we access specialty appropriate quality measure lists? Right on mipspro.com, if you click on quality measures, you'll be able to see measures broken up by specialty recommendations as well as CMS recommendations for those measures. Was cost calculated for 2020? Yes, cost was calculated for 2020. It was not for 2019. I am new to MIPS. Is there an easy way to describe points? Yes, there's an easy way to describe points. You need to, it's just like a school assignment. You need out of 100 points, you need to score in each one of the categories based upon what you are eligible to report on. The higher you get in points, the better the reimbursement or the less penalty that you're going to receive based where you are on a chart. So in each category, there are certain points that you can get allocated to yourself based upon the work that you do. So for instance, in improvement activities, you can get 15 points towards your total score. But please feel free to reach out to us at our team here. We could help you with that. So the multi-specialty groups using MVPs, there has been some information. So someone asking how will multiple specialty groups use MVPs? There has been some information shared on that. It was in part of the final rule, but as I stated earlier, it's going to take 3 to 5 years to implement this program. And before it comes out in 2022, there will be some massive changes. So I don't think you need to dig into that currently with what you're doing. So someone asked, it sounds like penalties and incentives are not binary this year based on specific cutoff scores below or above certain percentage. There are cutoff scores that are associated with this. You have the cutoff scores at 60 points. So anybody below 60 will get penalized. Anybody above 60 should be receiving incentive, and then above the 85 for the exceptional performance. So those are the cutoff points. However, they will scale up like every other year. Those who score above 60, the number will increase in incentive all the way up until you get to 100. So cost, someone asked here, can you explain how cost is calculated in a general summary? Cost is calculated by taking a look at two main measures, which are your total per capita cost and your MSPB, and those are only associated with certain types of providers. And then there are episodal measures that are a little more specific to specialties. And then it's based upon the risk score. So everything is done on risk score when cost, the risk score of your patients. So how sick are your patients and what is their cost compared to those that are in the same category or doing the same things as them. We have entire webinars on the cost score. If you want to go to our website, you can still view all of our webinars. The cost webinar is an excellent resource for understanding cost. It's not a short explanation, but that is the gist of what the program is. Is there a MIPS reference for those of us that are new to reporting? Yes, you could go to our webpage. We have, so there's a couple areas. We do have what is MIPS in 2020, what does MIPS in 2021 mean? There are also webinars, so there's an advanced webinar, but there's also a beginner's webinar for MIPS Pro and for MIPS users. They have the ability to do that. And I highly recommend this year that you work with someone, especially if you're new to the program. Work with someone, learn from a specialist that's out there that has done this for years that can help you maximize your score. Whoever you want to work with people that know what they're doing when it comes to MIPS. Whether that is us at MIPS Pro or whether that is a consultant in some way, work with them to maximize your score. This is not a learn while you're doing year for sure. Where do you find the specialty measures? If you go to mipspro.com, you click on the measures section, and then you're going to click on quality measures. And then from quality measures, you'll see up at the top, you'll see 2020 MIPS measures. The 2021s will be up soon, but the 2020 measures are currently there, and you can select your specialty from the specialty recommendation lists. New measures. So there are not a ton of new measures that are out there. There's very little, to be honest with you. There's just the two claims measure. However, for this specific person asked about behavioral health measures, there are a number of new measures that are part of our QCDR that we are in participation with the APA. And those measures can be found at mbhregistry.com. You could see those measures for the MBHR. We also do have specialty measures that are part of our program for audiologists, for PTOTs, for emergency providers, as well as hospitalists and anesthesiologists. So you could come to our system, you come into our program and take a look at those. There are a number of new measures on that list. You got it. All right, guys. There are a couple other questions that I'll be able to get to after the call. I think I'll let everybody go. I really appreciate your time today. Thank you for being patient with the 2021 proposed final rule webinar. And we hope to see you here with MIPS Pro. And I appreciate everybody joining me today. And please feel free to reach out with any questions. Thank you very, very much.